Welcome to the December 2022 CFP Distilled, whether you're listening on podcast or video. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
So let's take a look at the clinically relevant articles from this month's CFP journal and also bonus tips if you're studying for the CCFP exam.
Coming up in only a couple of months for a lot of you out there. It's great that we're getting to the end of the year. We're going to have a great summary of all of this important information, all of the CFP journal summarized.
Before we do that, we always start with a cover critique. This is a tradition that we've started, and let's take a close look at this maze. I mean, it's pretty dreary.
It's pretty dreary and dark. I don't know if I would put this at the end of the year. I'd want a little bit more of an uplifting one maybe next year. They probably don't listen to us.
Light at the end of the tunnel, maybe that's supposed to represent hope. Anyways, there is hope if you are studying for an exam, because we're going to summarize these things succinctly. What is our first article, Paul?
The first one is about spinal cord injury and some of the complications that might arise from this. So we're thinking about spasticity, we're thinking about UTIs and pain. So those are the three big things to wonder about considering these patients. Great article, short article. The biggest thing to take away from this one is actionnuggets.ca. So this is an app that has the 20 most common issues that may come up with spinal cord injury and what to do as a family practitioner.
Moving on to UTIs in the broader population, something we see all the time. What are we going to do for those folks who come to us and they ask for prophylaxis? What can I do to prevent UTIs? And again, if you're studying for a SAMP or on a SU and you want to have management tips, this article is great because they look at the evidence, but they also talk about the non-pharmacologic and the pharmacologic management. So some non-pharmacologic tips: increased water intake, as well as if you're postmenopausal, thinking about things like vaginal estrogen and vaginal lubricants. So that can be given as a ring or cream when you're giving that estrogen. So when it comes to the pharmacologic management, what does the antibiotic prophylaxis do? We don't know what the best one is yet. We don't know the best regimen. Things might include something like Trimethoprim Sulfamethoxazole, but we do know that it's going to reduce your incidence of UTI. We're talking about going down from 66% having a UTI if you're on placebo, down to 12% if you are taking an antibiotic prophylaxis.
Now let's move on to children. We've talked about spinal cord injury, we've talked about UTI prophylaxis in non-pregnant women, but what about those newfangled pumps? Remember when type 1 diabetes was a death sentence? Well, they've taken the die out of diabetes. We've now got insulin pumps, but what can happen with these? What are those complications that you might have to manage as a family physician? So great, once again, 2-page article that talks about some bubbles. What do you do about that? Big things you need to worry about: skin complications. Is there tunneling in adolescence? Is there an infection at the site? So great article to just quickly read up on what are some of the common complications with these new diabetes pumps.
And let's wrap up with a new mnemonic for your delirious patient. We all learned about DIMS in medical school. So drug, infection, metabolic, structural. What do they add to this new mnemonic?
So they've made it DIMS 5. So let's get that up on the screen and let's walk through it.
So as we go through the DIMS plus 5, the first thing is going to be pain. And then the next is going to be intake and output. So liquids and solids.
Urine and bowels. And then we're going to talk about the senses. So senses, sleep, setting, stasis, and stress. So we've expanded DIMS 5. There you have it, DIMS 5 plus the senses.
And there's a great box 1 in this article. I would take a close look at that. If you're studying for SAMPs, you want to investigate these folks. Which testing would you do to investigate? Now, with all due respect to the guideline author here, they probably would fail a SAMP on this. Why is that?
Well, in the list of recommended tests talks about CBC, it talks about a blood gas, but we know at the CCFP hospital, like we teach at the course, you've got to be specific. So that you can't write CBC, you've got to write the specific indices, you've got to write hemoglobin.
So wouldn't it be great, Paul, if there was a way to quiz ourselves and test ourselves on this content from the CFP journal, from all of 2022? Is there a way I could get practice SAMP questions from the CFP journal?
This is what we've done year after year. We've created a SAMP, a practice SAMP, where we've taken all the clinically relevant stuff out of the CFP journal, distilled it down, turned it into SAMPs, and I'm so excited. It's such an amazing product. Every year people love it. It is tough, but you get the chance to review all of the CFP articles made into SAMPs once a year. So the national SAMP is coming out in January.
So go to thereviewcourse.com and take a look at the products we've got there. And what we're talking about right here is called the 2023 National Practice SAMP. So on behalf of the Review Course, I'm Dr. Simon Moore.
And I'm Dr. Paul Dillon.
Take care.